Good afternoon, and welcome to today's webinar, Winter Wellness, Supporting Mental Health for Older Adults and Caregivers. Before we get started, here are a few reminders about the webinar technology. Please make sure you're using a computer or smartphone connected to the internet and the audio function is on and the volume is turned up. Please be sure your microphone is muted for the duration of the call. Questions can be submitted anytime during the presentation using the chat feature located on your control panel. American Sign Language interpreters and closed captioning options are available for today's event. The American Sign Language interpreters for today are Susan King Lanier and Danette Steelman Bridges. For closed captioning options, select the closed caption feature located on your dashboard. To adjust your video layout and screen view, select the View feature located in the top right-hand corner of your screen and choose the view that works best for you. Today's agenda topics include welcome, introductions, and presentations about mental health challenges among older adults and caregivers. At this time, I'd like to turn it over to Renee Rader, Deputy Director and Chief Operating Officer of the Division of Mental Health, Developmental Disabilities, and Substance Use Services.
Thank you, Dina, and good afternoon, everyone. Thank you so much for joining today's webinar to help raise awareness and deepen understanding of the unique mental health challenges that older adults and their caregivers often face, especially during the winter months and the holiday season. This time of year can bring joy, but it can also intensify feelings of loneliness, loss, stress, and isolation. Today, we hope to shine a light on those experiences and explore how we, both as individuals and community, can respond with compassion, support, and meaningful connection. Throughout today's discussion, I invite you to think about how you can check in on the older adults in your life and ways to offer small but meaningful acts of support for older adults and caregivers. Before we continue, I wanted to share a couple of important mental health resources that are available year-round. These services are free, confidential, and available 24/7. The first one is the 988 Lifeline. If you or someone you know is experiencing emotional distress or a mental health crisis, call or text 988 or chat online. 988 provides resources in Spanish as well. They also provide dedicated support for veterans and for individuals who are deaf, hard of hearing, or have hearing loss. The other resource is the NC Pure Warm Line, which you can call by dialing 1-855-PEERS-NC or 1-855-733-7762. This is another valuable resource that connects callers with trained peer support specialists. Before I turn it over to our first presenter, I would like to remind you that no one has to navigate these challenges alone. Support is available and connection is possible, and each of us can help create a kinder and more hopeful winter season for older adults and their caregivers. At this time, I would like to turn it over to Sarah Jane Melton, Director for Southwestern Area Agency on Aging. Enjoy the rest of the webinar.
Thanks, Renee. And happy Wednesday from Western North Carolina. I am Sarah Jane Melton. I am the Southwestern Commission Area Agency on Aging Director. And if you know the geography of North Carolina, we're in the west. We are west of Asheville all the way to the Tennessee line. And we consider it an honor to serve those counties and the older adults and caregivers who reside there. I've been at the Commission since 1997. At first as the ombudsman and then as the AAA director. So I enjoy what I do and enjoy helping others. And I am thankful for this opportunity. And hopefully we can help older adults and their caregivers navigate the journey that sometimes includes isolation and loneliness. If you'll advance the slides. So let's define, what is social isolation? Well, in my thinking about this presentation, I was just trying to figure out what would be the best way to present this. And in my mind, social isolation is the activity. It is the action step. It is what happens when we are physically separated from others. It often stems from our circle closing in, deaths of close loved ones, and other barriers. But it is the action step. It can be a choice, or it can be a circumstance that you find yourself in through no fault of your own. And I use a few stories in my presentation, and one of them, it relates to my mom. My mom's choice was to be isolated. That did not occur as she was an older adult. That was a part of her all her life. And unfortunately, that created issues with anxiety and her physical well-being and everything that relates to us being human. And then there is the circumstance that you find yourself in that may be no fault of your own. And I use COVID as an example of that. All of us that were in the older adult world and in the aging network remember, and everyone else does too, March of 2020, when really and truly the target of COVID, through great means and folks who really were trying to understand the pandemic and the disease, trying to protect our older adults, our most vulnerable. But the target was on them, and they were isolated. Social isolation and loneliness is not a new thing, but it certainly did magnify during that time. And so as a result of being isolated, our older adults began to show physical symptoms, anxiety, loneliness, all of those things that we're chatting about today, and through no fault of their own. And some of them are still very fearful. And we try to meet them where they are and understand where they are and offer information and resources for them to move forward. If you wouldn't mind to advance the slide, please. So we've talked a little bit about social isolation. What is loneliness? Well, loneliness is the emotion. Loneliness is the feeling. That is what sometimes we can't even identify what that is. It's this feeling inside of us that is sad and distressful and brings anxiety, and there's lack of connection with other folks. We are social beings as humans, and loneliness creates this sometimes undescribable feeling within us, and we sometimes don't know what to do with it. It can, and as it grows, and we don't know what to do with it, it certainly can affect our physical, our emotional, our mental, our spiritual health, and everything above. Not fitting in, not being with friends, not seeing friends. I myself can say I have been in a room full of friends, but also felt lonely at the same time. I just didn't fit. And so it created this feeling of loneliness within inside my body. And sometimes I don't know what to do with it. Sometimes I have to rely on family and friends to help me through those awkward situations. And I think that's what we do as both personal and professional caregivers, because we try to help folks through those moments and give them some sort of peace, as well as opportunities if they so choose to take them. Would you mind to advance the slide, please? So we've talked about social isolation. We've talked a little bit about loneliness. We've kind of defined them. And again, they are individualized, just like lots of other things are. So it can look different from one person to the other. But there are some barriers caused by isolation, particularly for the older adult population, but it also spans the age spectrum. Particularly when you live where I live, broadband and connectivity can be a real issue. There are pockets of every county in the region that I serve that still have landlines because they do not have cell phone service. And so when you think about that, you think about, oh, FaceTime with your grandchildren or children, or even online activities, telehealth, those kind of options are not available for those folks. So that just creates more of a barrier. It becomes bigger and bigger. Of course, caregiving responsibilities, we all know that caregiving really is a 36-hour day. And if you are caring for someone and you're also isolated, because a lot of times the loved one that you care so deeply for cannot go out of the house, or it is quite the burden to get them out of the house into the car and to wherever you need to go. But that can also intensify caregiver stress. They aren't taking care of themselves, and so it just builds and builds and builds. The mobility limitations, that connects with caregiver responsibilities in that folks having mobility issues, it is hard to get in the car, hard to get them into different places. And so it makes it even harder to interact with other folks. And those folks with dementia, changes in environment really can cause added stress and anxiety for those folks with the dementia. And then transportation challenges are a real thing in rural America, and we have that. In every county that we serve, we have individuals who live an hour from town, if you will, and transportation is an issue. Those are also the folks who have broadband and connectivity issues. Those are also the folks who may have loved ones who live near them, providing caregiving responsibilities. So it just kind of creates this domino effect, and it gets bigger and bigger and bigger and harder to overcome through the lens of the older adult and of the caregiver. You advance the slide, please. So we've talked a little bit about the effect of it on older adults. And like I talked about earlier, loneliness is an emotion. It spans the age span. When I refer to my mother, she was lonely all her life. And that was her choice on some level. She continued on that track. My father, who is exactly the same age, they were born on the same day, is a very, very social butterfly, and he continues to have those social connections and walk and take care of himself physically, and my mother chose not to do that. But again, that was her choice. That was not something that was put upon her. That was just a part of who she was and her being. Isolation may be the result of our own doing, and may be the result of things beyond our control. However, there are opportunities within communities, they look a little different, that can affect that, can make things better. And we try really hard at the Area Agency on Aging to connect those dots for families and their caregivers to make quality of life better. If you wouldn't mind to advance the slide, please. So, what does this mean for those I hold dearest? Sometimes we have feelings of defeat and frustration because we've really, really tried. Relationships are strained. The person that we are trying to help continues to push us away and say, I don't need help. Lots of times, like I talked about in one of the first slides, they don't even identify what this feeling inside is. And so when we ask, are you lonely? They say no, because that is a part of the anxiety, and they just don't exactly know what that is. And I think a lot of our older adults will minimize the importance of these feelings and don't understand necessarily the connection between isolation and loneliness as it results to our complete being and all that means health when you are a human and an older adult. You see some statistics there. 43% of older adults are impacted adversely by loneliness and social isolation, and 32% increase in the risk of a stroke. Again, we are social beings. Do you advance the slides, please? So I've talked a little bit about all the definitions and what social isolation and loneliness means, but there are opportunities. There are opportunities that look different in every community. However, I have listed a few that can help bridge the gap between folks who feel isolated and lonely and potentially get them re-engaged. Community engagement, senior centers are a great opportunity. I know Rebecca's going to talk a little bit more about that. Senior games, libraries are a fabulous resource depending on your community. Parks and recreation, schools, volunteering in schools, faith-based organizations offer great opportunities. Food banks, volunteering in that food and food insecurity certainly is at the top of our list at this particular point in time. So that could offer a volunteer opportunity. And then the list is endless. It depends on the community you live in. It depends on the county you live in. And it also depends on your interest. What are or the older adult you are caring for interested in, and where can those connections be made? Thanks so much for allowing me to present today, and I will turn this back over to Lisa.
Hi, everyone. Thank you, Sarah Jane, for such a thoughtful and insightful presentation. Just making it real practical that loneliness can be a choice, and it also can stem from geography and just from the environment, thinking back to COVID-19 and how many of us are still dealing with that. Now we are going to transition to Dr. Kelly Graves, who will speak to us about the impact of isolation. I'm sorry, I'm checking the chat. I don't see any questions at this time, but please, a reminder, you can put your questions in the chat. So we're going to move forward to Dr. Kelly Graves, who is the CEO and founder of the Kellen Foundation, who will speak to us more about the impact of isolation. Welcome, Dr. Kelly.
Thank you, Lisa, and good afternoon, everyone. Hope everyone's doing well. I have the honor and privilege of talking about the impact of isolation and just context on who I am. So I am a psychologist by training, have always been very passionate about taking best practices and what they often term research-based approaches and thinking about how we translate those into various settings. And so I launched the Kellen Foundation to kind of serve as a demonstration site of that. We are located in Greensboro, but we do serve across the state. We have multiple programs across the state and at last count are in 42 counties. Our focus is in behavioral health and all of the things that come with that. So while we're behavioral health focused, we take much more of a kind of a public health approach, knowing that when somebody is struggling with a mental health concern, there's also other things that go with that. Our focus area has been on stress and trauma and how stress can impact the brain and the body. So that is a little bit about us. We serve about 12,000 people a year and are part of what's called the Hope Hub in Greensboro, which is a multi-agency, multi-nonprofit prevention and treatment hub. In that setting, what we were hearing about from our community members a lot and what we were seeing in terms of referrals is this uptick in the needs, behavioral health needs in particular, of older adults. And so we serve the lifespan, but we're specifically building out opportunities to help fill that gap. And we've been doing that for the last couple years now and learning more and more about the impacts and the needs of older adults in the behavioral health space. So I'm going to talk a little bit about that here and some ideas and solutions for how we can help support older adults. Next slide, please. So I'm going to talk about some of the domains where we see impacts and how it shows up. Now, obviously, every person is different. So what shows up for one person may be different than for another. But in general, because we're social beings, as Sarah Jane so eloquently talked about, that social connection is a major driver. And so when we're isolated, it can show up emotionally and psychologically. Social isolation is one of the strongest predictors of depression in older adults. Without that regular social context, many older adults experience elevations in anxiety. They may increase their sense of hopelessness. And that chronic loneliness can actually alter our brain chemistry, even leading to decreased motivation and troubles with emotion regulation. You might see older adults whose brain chemistry is shifted due to isolation, who have more emotional extremes and have a harder time being able to manage their emotions. The loneliness aspects can also accelerate our cognitive declines, especially among those that are living alone or that are particularly isolated. When we're lonely and we're not engaging socially or interacting with material on a day-to-day basis, the neural connections in our brain decide that if we're not using them, then we must not need them. And so a pruning process happens where different neural pathways will begin to get pruned. And then we see kind of a cognitive decline as well. So isolation has that impact as well. Next slide. In terms of physical health consequences, we see, as we saw an increase in stroke risk of about 32%, but also in general increase in heart disease, 29% on average. But in general, even without kind of heart disease and stroke, some of the major pieces, we see a daily kind of weakened immune system. We see older adults more likely to catch colds, flus, streps, other kinds of general illnesses, because what we see is when we're more isolated, our immune system is more suppressed. So it makes them more prone to illness and also a slower recovery in that process as well. Our isolation can often lead to kind of that reduced physical activity. When we're more isolated, we tend to be moving less. And so that can also connect to a higher likelihood of falls and other functional declines. And our health effects of loneliness have been shown to be comparable to smoking up to 15 cigarettes a day in terms of on our physical health. And we know the impact that 15 cigarettes a day can have on our health. We now see from the research and from the data that the health effects of loneliness have a comparable impact. So in terms of why we want to look at isolation in older adults, I think the physical health why is pretty striking and pretty clear. In terms of some of the cognitive and neurological impacts, the social engagement that we have, it keeps our brain active through ongoing conversation, through emotional processing, through even kind of some of the more basic things of listening to what somebody is saying and then thinking about that and responding in just kind of a normal conversational way. That activates the brain and keeps those neural connections going. Without that, we see a reduction in that mental stimulation, contributing to that cognitive decline. But we also see that socially isolated adults can have an up to 50% increase in developing dementia. So the more isolated, the less we're using our brain, the less we're interacting socially and in different environments, the more likely our risk for dementia is. And so that social interaction is a form of protection from cognitive decline. It helps to preserve our brain health. It helps us emotionally, physically, and psychologically as well. Next slide. All right, one of the things that I didn't mention on the previous slide that I just wanted to highlight, I think I accidentally skipped over the social and behavioral aspects, but one of the things that we see is as isolation increases, we see a change or shift in that social and behavioral patterns, which could increase the likelihood of skipping kind of regular appointments, skipping preventative healthcare visits and screenings, not identifying potential crises or elevating concerns until they're further along into kind of full medical emergencies. So that isolation can also increase some of those social barriers as well. One of the things separate from the individual's kind of health and well-being, we also see on another level the economic and system level impact of isolations. Our isolated older adults tend to incur much higher medical costs. Typically, that's because chronic conditions continue without being managed due to the isolation. Either they've are unmanaged ongoing or unidentified because they haven't sought preventative or our routine healthcare visits. Our caregivers can also experience from that an increased emotional and financial strain. With decline and with additional health issues come additional factors to create kind of a cycle that can make it more stressful emotionally and financially. And that isolation also increases our reliance on kind of the more costly emergency interventions, like showing up in the ED and waiting until certain conditions get more severe. Of course, at that point, we need more emergency kind of interventions as well. So it's not just the psychological and social and cognitive piece, but we also see big economic and system level impacts as well. The good news is, if we can go to the next slide, we have tools and we have strategies to offset that, right? We have resiliency skills that we know work. And just as Sarah Jane shared, some of the solutions are going to look very different across communities and even within a community, within an individual. The key is to take that individual approach and develop solutions that work for that person or a subset of people. And that includes strategies that build social connection. And that's very broad. For some, it might be engaging in Parks and Rec. It might be participating in a prayer group at church. It might mean having like a standing lunch with a friend, right? So those social connections can look very different. The key is to find what works for that person and help to facilitate that, whatever that looks like for that individual. Social connections for some also mean concrete things like learning how to engage in digital technology so that I can keep in touch with my family members that are, on the other side of town or out of state. So digital literacy programs could be really helpful, enabling, a telehealth outlet. So if they can't see family members because they're not local, helping to build digital skills to be able to tap in and at least have FaceTime calls or connections or phone calls with loved ones to help increase those social connections if they can't be in person. So integrating strategies like that can be really helpful. Other types of strategies to address the impacts of isolation include helping to integrate mental health into health overall. One of the things that became apparent for us in our community is that it seemed like what we were hearing is that the needs of older adults were mostly covered except behavioral health. It seemed to be kind of the thing on the side. And one of the things that I think is critical if we're going to build solutions and reduce isolation is to integrate mental health screening wherever possible, into primary care settings, into senior centers, into community centers, so that we can detect that isolation early and provide supports as early as possible. Building up programs like intergenerational and volunteer programs that foster purpose and belonging can be another strategy, because a lot of older adults that we've encountered want to do something for others. They want to give back. They want to support others, and finding opportunities and activities that they can plug into and feel good about and feel like they are successful at not only increases their social connection, but it builds their agency. Even in a phase of life where they might feel like they don't have as much control over some things, they're able to feel like they're in control and they can accomplish tasks within these volunteer programs and opportunities as well. So those are some of the ways that we can build in some protective factors, build in some solutions to inspire hope, to help our older adults feel more socially connected. But that connected piece, I think, is a theme that we're already seeing throughout this webinar so far, is that building those opportunities for connection is one of the biggest ways that we can offset the impact of isolation on older adults. Okay, I think I pass it back to Lisa.
Thank you, Dr. Kelly, for just giving us some very practical ways and even showing us that conversation is very beneficial to brain health, and that it doesn't have to be we don't have to bite off such a big piece, just starting small with conversation. Thank you so much for that. Looking at the chat, I do not see any questions. So we'll move on. Our next presenter is Rebecca Freeman. She is the Section Chief of Aging Service Operations with the Division of Aging. Please help me welcome her. Ms. Rebecca.
Thank you, Lisa, for inviting me today, and thanks to everyone who has joined this important webinar. I love the name of this portion because I do think we all have a role or a collective responsibility in addressing social isolation, loneliness, and mental health concerns among our elders. So just to share a little bit about myself, I did not set out to work in aging. It's something I kind of stumbled upon. I landed my first job at a senior center in Wake Forest and truly did not even know what a senior center was at the time. But I always tell the story when I talk about social isolation and loneliness of Miss Joan. She was a person who attended the center, and I was kind of young, getting children to school, always stressed getting to work, and I used to get to the senior center. I had the keys and I would open it up. And there was a lady, Miss Joan, who she would come to the center in the morning and stay all day. She kind of was in charge, if you will, of our craft room. And I would get to the senior center at not even late, that we opened at 8. I would get there maybe at 7:55, 7:58. And she would always be there waiting impatiently. Sometimes she would tap her cane on the cement and say, "You're late." And it used to get on my nerves so bad because I was, trying to get to work, a mom and stressed out from traffic probably. But in time, and I didn't know the term social isolation and loneliness at that time, but in time I learned that the reason that she was that way was because the senior center was really her lifeline. She was a widow and really didn't have a lot of friends. And she told me in time that the senior center really made a huge difference in her life. And so I was really glad to have that opportunity. And it really shaped my career moving forward. After working at that senior center, I went on and worked in Johnston County. I oversaw our senior centers across the county. And then I came to the division in 2014. I worked with senior centers across the state before moving into the role that I'm in now. So if you want to advance to the next slide. So I think Sarah Jane was the one who mentioned it. During the pandemic, we really got a spotlight shined on social isolation and loneliness for the very first time. I don't know if you're aware, but there are other nations who have really taken this issue really to heart. There's a minister of loneliness in a European country, I believe in an Asian country. There's somebody at the very high level looking at this, and recently our own Surgeon General a few years back had talked about loneliness as a epidemic in the United States. But 2020 was a special year, as we all know, for a number of reasons. We had the pandemic, and the pandemic impacted all of us. I really, as Sarah Jane said, I think it impacted aging more so because older adults were at highest risk of dying from the disease, from the virus. And so, and senior centers and congregate nutrition sites and all the different programs that older adults look to be connected with others shut down pretty much overnight. And so the Suicide Prevention Resource Center out of the University of Oklahoma, sometime in 2020, published a document called, and the link is with the slide, it's called key steps to reducing loneliness and social isolation among older adults. The intended audience of this document, I believe, is professionals, but I think that the lessons in it can be applied to anyone, and remembering we all have a role. So I wanted to start there and sharing this with you. So the first thing that document tells us to do is to consider whether an individual may be lonely or socially isolated based on their life situation and risk factors. Just, consider it, like think about it. That's something that shouldn't have to be said, but really it is not common sense. We have not always thought, is this person lonely? So having that at the forefront of your thoughts when you encounter someone who maybe is in distress, and don't wait for them to tell you. Ask them, "Are you lonely?" Is something that you could all do. And then specifically for professionals in the audience, and if you're not a professional, I will share with you in a few slides how even you could do this. If you suspect possible loneliness, assess the individual. There's several different tools out there, and the one I'll share with you is based on it is the UCLA 3-item loneliness questionnaire. But there are other tools out there. And as Dr. Graves said, she's kind of stealing my thunder. We have been saying for a long time that this needs to be incorporated into routine screenings throughout, human services, health services, and that could be something that professionals on this call could take and start doing right away. And then thirdly, and this is really key, if an individual is lonely, try to understand why using an empathetic, non-directive, active listening approach, and most importantly, connecting them to the most appropriate resources. Because not everybody is lonely for the same reason. There are a variety of reasons, and the resources that you want to provide to someone should be person-centered and based on their particular needs and desires. So if you want to go ahead to the next slide, we'll talk about how you can do that. So the Suicide Prevention Resource Center suggests, again, that we share resources that may be helpful for addressing the cause of the individual's loneliness, keeping in mind their needs and preferences, and importantly, based on the underlying reason. So here are some reasons that you may see an individual is lonely and some resources that may be applicable. So first, improving social skills. It could be, I believe Sarah Jane might have said, you can be in a room full of people and still feel lonely because you're feeling like you can't connect with them for one reason or another. And so sometimes it could be about improving social skills. And there are things such as online social skills training and psychotherapy focusing on social skills as examples of ways that you might then help this person, get them and connect them with those resources. A second reason is increasing social support. So this is more your isolated individual, somebody who doesn't have a lot of connection. And so kind of what we traditionally think about, things like to increase their social support, friendly visitors, virtual connections, as Dr. Graves mentioned, in person, such as senior centers, et cetera. Even in-home services and support. We have in North Carolina, well, throughout the nation, the Meals on Wheels motto is more than a meal, because, that person brings the meal to the older adult, but they also lay eyes on them and say hello. And sometimes that's the only contact that an older adult receives. Thirdly, increase access to social interactions. So we do know that a lot of people, would love to be around other adults, but for some reason, they are unable to do that because of caregiving responsibilities, because of assistance, because of transportation issues, because they have potentially some kind of disability that challenges their ability to communicate. I'm glad that we have an interpreter here today. I have talked with folks in our sister division of services for deaf and hard of hearing, and they too have talked about how social isolation and loneliness really impact the population of folks that they help. And so making sure that you provide the resources that can help make social interactions more accessible, such as transportation, online chat, assistive devices, or connecting to specific activities and events. And then finally, perhaps the person has unhelpful thoughts about social situations. And so, in that instance, maybe cognitive behavioral therapy is a type of therapy that could help address that. Mindfulness and meditation have also been shown to have a positive impact if unhelpful thoughts are the issue. So, I wanted to make sure that you all had those resources. It's a great fact sheet. I encourage you to check it out. It's a pretty quick read as well. If we go to the next slide, I will share some work that we've done at the Division of Aging. So after the pandemic occurred and we shut down, we formed a work group at the division because we knew it was such a tremendous issue, particularly in the aging network. And I won't go into all the things that we did. One of the things that Dr. Graves mentioned, digital, we did lean into digital in the aging network. We knew some senior centers across the state started offering virtual programs. And as the state, the body that oversees senior centers statewide, we did require that senior centers, if they were open, if they were still receiving funding, and they were one of our centers of excellence, which is a certification they can get from us, that they offer virtual programs to make sure that those people that normally would come to the senior center would have at least some sort of connection. We then, the thought came about, traditionally, if you live in a community, you go to the senior center that's located in your community. But if a senior center is offering virtual programs, does it have to be just for the people that live in that community, or could people, say, in the far western side where Sarah Jane is, attend virtual programs in the far east if they're able to find them? And so we developed a website. It was originally on a different page, but now it is in Social Bridging NC. And the original intention of this work was to have a place where senior centers could offer their virtual programs. And then it evolved because there's other entities that may offer virtual programs. And so we invite anyone who wants to share programs to have them there. But we really ended up building out this website to have many more resources. I mentioned earlier that I would share something for assessing people's needs. We connected or linked the UCLA loneliness assessment in the website, and the website link is down there. So if you encounter somebody, or if you don't have a screening tool and you're a professional and you wanted to sit down and assess them, there's a self-assessment that people can take. I believe it asks them, there's a self-assessment for connection, and then it takes them to the loneliness. So it's kind of a two-part. And then most importantly is if they screen and show that they're really at risk, then there's a message that goes back to our partners who connects them with one of our area agencies on aging so that we can get them to the right resources. But some other things on there, as I already mentioned, there's the virtual events. One thing that I'm really, really proud of is over time, we just kept hearing about all of these resources that exist throughout the state. And Sarah Jane mentioned some of them: cooperative extension, libraries. I can't name them all, but we started to collect them. So there's a very, very rich resource page in there. And pretty hot off the press is our new toolkit that we've created about social bridging and how agencies can replicate that work, set it up. This was based out of work that UNC Asheville did. They got a grant called Social Bridging, the Social Bridging Project. And that was a project where originally it connected students with isolated people during the pandemic to be able to provide them resources, including just a friendly voice on the line, but also connect them with other resources. And so this toolkit is very robust. It talks about how they set that up and how you could do something very similar, provides a lot of different materials so that you could also do something similar. So if you want to go to the next slide, I want to save the best for last. So Sarah Jane mentioned senior centers, and I shared that that's kind of my why. I started out at a senior center. I also learned when I was in Johnston County, I got to see in some areas that were pretty rural where there weren't senior centers what it looked like if people didn't have the opportunity. And I remember one lady in particular who we provided a holiday gift for out of our holiday program for older adults, and she was very lonely. And I saw such a spark in her and so much creativity, and I kept thinking, wow, if she lived in Wake Forest or somewhere where there was a great senior center, her life would be so different. It would be so rich. And so I am a very passionate advocate for senior centers. Um, but it's not just me. Back in 2016 or 17, we did a survey. And for those of you who are researchers, you'll know that this was a pretty robust survey. We had over 7,000 older adults respond throughout North Carolina. And it kind of asked, like, because I attend the senior center, and they could rate themselves. So we looked at well-being, we learned at their ability to learn new information and skills. And you can see here, I feel less lonely and isolated, et cetera. I won't read all of these to you, but we had overwhelming positive responses to all of these indicators. And we did ask people to write in their own words what the senior center meant to them. And we had some people, I remember this one always stands out to me. They say that they found the senior center and it saved their life. They had been feeling, like they didn't want to live anymore, and finding the senior center made that huge of a difference in them. And so I encourage you to look at that document. The link down here, Benefits of Participating in a Senior Center, is a document that kind of summarizes this image that you see on the slide is on there. But for anybody who is on this call today, if you need to find your senior center, I'm really happy to share that on both the Social Bridging NC website and also on Healthy Aging NC's website, which is healthyagingnc.org. You can click on this and it allows you to plug in your address. So you can do it for yourself if you're an older adult in the audience, or you can do it on behalf of an older adult that you care about and find the senior center nearest nearest that person. So that's a great resource that we all can use to help with this issue. And that's everything I've got. Thanks.
Thank you, Rebecca. That was just very timely and informative. Just that noticing and understanding that loneliness is an epidemic, and that we do need to be talking to people in a way that is beneficial to them, that people are lonely for different reasons. Thank you for making us aware of that, and even giving us some tools to screen for the providers who are online. Thank you so much for that. So we're going to move into our polling question. Which of the following actions are you most likely to take after this webinar? Reach out to an older adult, share resources with a caregiver, volunteer at a local program that supports older adults, start a conversation about mental health, or I am not sure. No matter where you land with these questions, with your answer to this question, know that we're all on this journey together. So I think we have 22% say they will reach out to an older adult, 52% share resources with a caregiver, 1% volunteer at a local program that supports older adults, 19% start a conversation about mental health, and 6% are not sure. But again, it's a journey. We've been given a lot of resources, a lot of information today, and a conversation can produce change, and it starts individually and then it becomes a collective impact. So wherever we are, let's just take time to digest what we've learned today and step out and make a change for the better. And supporting older adults doesn't just uplift older adults, but it uplifts our entire community. It makes us all stronger, so that we can create a place that we want to live and be a part of and be proud of, a community. Checking the chat. There are no questions in the chat. I'm going to turn this back over to Dina.
Thank you, Lisa. If we did not get an opportunity to answer your question during the webinar, questions and feedback are always welcome at bhidd.helpcenter@dhhs.nc.gov. The recording and presentation slides for today's event will be posted on our Community Engagement and Training webpage. For more information and resources, stay connected with DMH DDSUS by attending our monthly side-by-side webinars and joining our mailing list. The links are included in the chat. There'll be a brief survey following today's webinar, and we would appreciate your time completing it. This concludes our event for today. Thank you for attending.